Hi everyone, welcome to IMG Australia channel again. Today I'm going to discuss some important things to you guys. Especially this video series is to deal with how we orientate into the Australian healthcare system. When I say orientation, the healthcare system in Sri Lanka, India, or any other country would be much different to the Australian system. Let's talk briefly about Australian system and then go into one of the areas or one of the topics I want to discuss today. Uh, Briefly, Australian healthcare system is not a free health system, just like Sri Lanka or any other country. But Australian healthcare system has some benefits coming from the government to the patients, which is like we have here what we call a Medicare system. Medicare is a universal healthcare system, health insurance system, which will fund the public hospital admissions, part of the private hospital admissions, and part of the private consults like general practice consults. If the general practice, there are different types of general practices. If the general practice is a bulk billing practice, as we call a bulk billing practice, that would be all the fees for the patients would be covered from the Medicare. If the general practice you go to is a mixed billing or private billing practice, then you have to pay something out of pocket. That means Medicare would cover some part of your cost for the GP consult. Rest of the fee you'll have to bear yourself. So in general, Australian healthcare system is not 100% free, but most of the services are free through Medicare, which is a universal health insurance scheme. There is another thing, which is the topic for the discussion today. There is another thing about prescription medicine. In Australia, most of the prescription medicines are subsidized through the government. The scheme is called the Pharmaceutical Benefit Scheme, or PBS. So today I'm going to discuss more about PBS and how a doctor who arrived here in Australia as a new medical doctor prescribed or navigate through PBS system. So the topic today is mainly part of the Australian healthcare system or the government subsidized system, which is the prescription medicine or the pharmaceutical benefit scheme. So I'm going to discuss more about PBS system. PBS or pharmaceutical benefit scheme is a government benefit given to the Australian residents or the patients. In that, significant proportion of the medication prices would be covered through PBS or the government. That means if you prescribe a medication which is PBS subsidized, the patient will only pay a minimal amount of a fee for the medication, but the rest would be covered through the scheme, PBS scheme or the pharmaceutical benefit scheme. Under the PBS, when a doctor prescribes any medication, you have to know what is called the schedule or the schedule of the pharmaceutical benefits. You should know whether it's the general schedule medication or is it the streamline schedule, or is it the authority required medication. So there are three types of medication when you prescribe medicine to your patients. Some medications are under the general schedule. The others need streamline code or they are streamlined schedule. under the PBS. And then the last group of medication, you have to ring the PBS and get the approval from the PBS for you to prescribe the medication to your patients. So I might have mentioned this before. I think the previous video I mentioned it to you briefly. When you come and start to work here in Australia, you have to take what we call prescriber number and provider number. So the prescriber number you get through the Medicare is for you to give the prescription right. And then the provider number gives you a lot of rights, including pathology referral, specialist referral, or referral to other hospitals and things like that. So if you are a PBS prescriber, you should first of all have a prescriber number. In general, a doctor to work in Australia, you need a provider and a prescriber number. So let's assume that you got the prescriber number already. And then if you go into prescribe medications, you go to PBS. There's a PBS website you can search your medications through. Then if you get familiar with this PBS website, that would be very helpful for you when you first come into Australia and start to practice as a hospital doctor or even a general practitioner. Let's go to the PBS website. I'll share the screen with you so that I can describe. Yeah, here. We are now at the PBS website. It's the Australian Government Department of Health and Aged Care website. In that, you got this PBS, or the Pharmaceutical Benefit Scheme. So if you want to search, I already searched the medication here. One medication which is under the general schedule, metformin, the medication given to diabetes. Metformin, you can prescribe metformin without having any streamline code or without having any authority number or authority requirement. So that means when you write a prescription, you can write metformin. Say this one, I open the one which is 850 milligram tablets. So if you prescribe metformin 851 daily, you could see here, you could actually give maximum number of packs patient can have is 1, and then the maximum quantity in a pack is 60, and then you can prescribe 5 repeats. So metformin, so if you prescribe one, like a 60 with 5 repeats, the patient will be paying only 15 and 55 cents. So likewise, it's under here, there are other brands of metformin and say diaformin, Sanders metformin and things like that. So there will be slightly different prices, I would guess. Let's see. Okay, so you can't put there. So what I discussed was the medications under general schedule. So you could search any other medication. These medications, if you prescribe these medications under general schedule, you don't have to get any streamlined code or authority number or anything. Let's see if you prescribe amoxicillin. Amoxicillin under general schedule. There's another one with the authority required, which is the if you prescribe 640 tablets, but if you give 20, you don't need any authority. I think if you go, sorry, I was just dragged to something else. Yeah, it is showing here 40 because usually a doctor will search for a medication which require a streamline code or a authority number. General schedule ones, you don't have to search. For instance, amoxicillin 20 milligram, pack containing 20 doesn't need any streamline code. But this amoxicillin with 40 in a pack, you need some streamline codes to fulfill. Like patient must be a male with acute cystitis, or patient must be having pyelonephritis or salmonella, community acquired pneumonia. These conditions you can prescribe 40. But otherwise, in general schedule, although I can't show it here, it's generally only 20 tablets. You can prescribe 20. So some of the if you try to understand this, some of the medications, if you want to prescribe increased quantities, then you need authority, maybe streamlined authority, or you call the PBS and get the approval number. So let's go to the one of the medications that authority required, maybe diabetic medication again, empagliflozin. Look here, empagliflozin, or like if you want to give empagliflozin, you will have to get a streamline code. Streamline code for prescribed empagliflozin is 7506. As you can see here, when you write the prescription, in the prescription pad, in one of the columns, you have to put this authority number. So 7506, which is for diabetes, and HbA1c should be more than 7%. And it is not well controlled with metformin or glycoside, for instance. So you tried those one or two, like sulfonylurea or glibenclamide, biguanide. And then if it doesn't work, then you use second line medication. For that, you need a streamline code. This is again, yeah, so different streamline code. When it's used with insulin, that's 4991. Okay, a few different streamline codes. So if I try to discuss what we have discussed so far, some of the medications, when you prescribe to your patients, they don't need any code, streamline code or authority number. Then you just prescribe it with the quantity and number of repeats. You don't have to put anything, like the example I took was metformin or amoxicillin 20 capsules. You don't have to get any streamline code. But if you prescribe something like for diabetes, for example, if you use a second, like a SGLT2 inhibitor, like empagliflozin, then you will have to use a streamline code. And then there are conditions to use this streamline code. As for example, here it says HbA1c should be more than 7, and then you should have previously tried sulfonylurea or biguanide. such as metformin, and then you couldn't control the blood sugar, then you use the second line medication. Then you use this streamline code 7506. Then we go to the other type of authority, which is like you have to call the PBS and get the approval. Example I usually take here is one of the antibiotics. Cancer, okay. So you search ciprofloxacin. This is I'm just searching through the PBS website. Just you guys, if you can familiar with the PBS system, and then try to find out different different schedules for the different medications, which would be very useful for you to know and get used to when you come and work in Australia. So ciprofloxacin, some of you from your own countries may be familiar, like you could prescribe Cipro without any hassle, but here in Australia you can't. You should say, let's click this one, Cipro 500. Authority required. So here it doesn't give a streamline code. That means you have to call the PBS. You can find it in the PBS website itself. I think it's 1-800 888 and 333, if I remember correct. 1-800 888 and 333. Then you call a person at PBS and then get the approval from them. Like the approval number. Then you put that number in your prescription. For example, if you want to prescribe ciprofloxacin, your patient should be either having a proven or suspected pseudomonas, and patient should be severely immunocompromised, or it could be bacterial gastroenteritis, or any other infection where pseudomonas was isolated. Then when you call, they will ask when you call, okay, I'm Dr. So-and-so, I need ciprofloxacin for my patient. This is my patient's Medicare number. And then you say, okay, this is their first name. And then you will get the prescription number, like under you, your prescriber number, they will have it in their system. And after going through those things, the PBS people will give you a authority number. You put that number on your script and then prescribe medication for your patients. So it's a good practice if you go to the pharmaceutical benefit scheme, the schedule, and then keep a look at this online schedule, or you can download this schedule to a CD and then go through different medications. When I say this, even ourselves, we don't have a lot of time to go through this, but if you can, it's very good. But otherwise, when you're prescribing, you should be, once you prescribe for a few years, you get familiar with these settings so that you know which one is general schedule, which one is streamline code, and which medication need authority approval from the PBS. For example, if you give quetiapine or Seroquel for a patient, it has streamline codes for, say, mania or bipolar affective disorder or schizophrenia. Then you have to use those different codes to prescribe those medications. Then there are some general schedule medications, like you don't have to get any approval, but it's under the general schedule for the patient, subsidized through the government. And then there are some medications you need streamline code, as I took the example of Seroquel, for example. And then there are some medications like ciprofloxacin here, one example I took, need the approval from the PBS. There are a few other conditions. There are some medication which got restrictions, for example, ciprofloxacin here. And then there are other medications which got similar restrictions, especially if you give what we call S8 medications, or medications, what we call drugs of addiction, or medication that patient can get addicted to. Always have a control through the PBS system. So that means if you give some medications like, say, morphine, oxycontin, indone, Targin, Palexia, or those medications, then if you give more than the usual number of tablets, then you have to get the authority from PBS. For example, if a patient is taking, usually from my memory, indone, they can have 20 tablets in one without the authority, but if you give more than 20, you have to get the authority through the PBS. Likewise, if you give the slow release preparation for oxycodone, which is Targin, if you give 28 tablets, you don't have to get the authority. But if you give 56 months supply, one twice a day, then you have to get the authority through PBS. So I just discussed a little bit about who are PBS prescribers. That's usually the doctors registered under Medicare and who got a provider number and a prescriber number, can prescribe medications. And then there are forms, PBS prescription forms. In a GP clinic, it's actually already formatted when you prescribe medication through your software. It's printed through the printer, no hassle. But in hospital system, you have to handwrite them. Then when you writing them by hand, you have to put the dose, frequency, number of tablets and number of repeats. And if you have a streamline code or authority number through the PBS, taken from the PBS, then you have to write all those. And then you have to write your prescriber number and your name and the signature to be a valid prescription. Likewise, the prescriptions given from the GP clinic that already has your name and prescriber, provider, everything populated into the prescription, your prescription, but you then have to sign and then give it to the patient. So I think you should be now familiar with what the general PBS prescriptions, like without any restrictions. They are like metformin, glycoside, say rosuvastatin, and I can give you plenty of examples which you don't need any streamline code or authority number from the PBS. Then you just prescribe number of tablets, number of repeats, and then you sign under. But if you need a streamline code, for example, the ones I took was the empagliflozin for diabetes. There are many others, like Seroquel for bipolar affective disorder or schizophrenia. Then you have to put the specific streamline code for that. And there are some medications which are restricted. So the benefits under the PBS are either unrestricted, like the ones, for example, for the metformin and all, and then restricted, like for example, like a streamlined code, say empagliflozin for diabetes with HbA1c over 7. And there are some other medications which have authority required. You have to ring the PBS and get the authority. The example I took is still there, ciprofloxacin on the screen. I'll stop the screen share. And then there are some principles about prescribing. There are maximum quantities and repeats. I think I just mentioned that one. From my memory, usually most of the medications, maximum quantity would be month supply, say about 28 or 30. And then number of repeats, generally 5. And then if you want to exceed those maximum quantities, let's take an example. If you're giving, say, sertraline 100 milligram, one a day for, say, 6 months, then you prescribe sertraline 100 milligram, 30 tablets, and then 5 repeats. You don't need any streamline code or authority number, and then you sign and give it to the patient. But for example, if the patient need sertraline, if your patient is taking sertraline 200, some people take them, and then you wanted to give a month supply, then you can only prescribe 30 according to the general schedule. But if you want to override the general schedule and get the authority approval from the PBS, you can. Then you can put the number of tablets 60 and then 5 repeats. But when you put that into your software, for example, in my software tomorrow, if I go to work tomorrow, when I go to work tomorrow, if I am to prescribe sertraline 200, then I would be, say, typing, okay, sertraline 100 milligram, 2 a day, 60 with 5 repeats. But the system automatically take me to the PBS authority. Then I have to ring the PBS and then get the authority approval, and then put that number in my prescription, and then print it and give it to the patient. So if you exceed the maximum quantity, for example, instead of 30, if you want to give 60, then you have to get the PBS authority approval. I think you understand what authority approval means. If you want to give more than the usual number of tablets, then you have to get the approval. Or if you want to give a specific medication, like some restricted medications like antibiotics or S8 medications or drugs of addiction, then you have to get the authority from the PBS. Then some principle about regulation 24. This is usually not used in hospital setting, but in the GP setting, I usually use this. When a patient says, okay, I'm going on a trip and then I need extra number of repeats to take, then you have to give 1 month supply and then like tick how many repeats you want, say 2 or 3, and then you tick regulation 24. You write it or write in the prescription or tick the regulation 24 in the prescription pad. And then that means the pharmacists know that they are supposed to release X number of tablets, say like not a 1 month supply, maybe 2 or 3 month supply in once. Okay, that's what we mean by regulation 24. You can search this regulation 24 PBS in Google, then you'll find out. So I think this is dragging on now. We should stop soon. If I try to summarize again, PBS or Pharmaceutical Benefit Scheme is a government scheme in Australia, which actually significantly reduced the price of the medication for the patient, or they give a subsidized rate for the patient. But for patient to be eligible to get this PBS subsidized medications, they should be permanent residents or citizens in Australia, like visitors or students or work visa holders can't get PBS medications. And then if they are to get the PBS medications, their doctor, like you and me, should know how to prescribe PBS medication. That's why I'm discussing this in this video. There are general schedule medications which doesn't have any restrictions when you prescribe, but restriction would be the number of tablets. Like if you can give only 30 with 5 repeats, not more. If you want to give more than 30, say 60, then you have to get the authority from the PBS. So then it becomes authority required medication. And then there are some medications with restricted benefits. That means they are restricted for specific conditions. For example, the example I took was empagliflozin for diabetes. Then it is, or the other example I took was quetiapine or Seroquel for mania or schizophrenia. Then they got streamlined codes or numbers, say 4, 5, 6, 7 or something. And then you have to put that number in your prescription. And then there are some medications which are restricted. Restricted medication, I took the example, which is a restricted antibiotic, ciprofloxacin, mainly for Pseudomonas or severe infections, or the patient is severely immunocompromised. Then you can get the authority, but the person who's answering your call from the PBS would ask, okay, doctor, what's the condition? Have you got a confirmed Pseudomonas case, or what's the reason for authority? Then you will have to give them the reason. If it's approved, then they will give you an authority number for you to prescribe Pseudomonas. And then the medications, if you want to give maximum quantity, more than the maximum quantity allowed, say like if you're using 2 tablets a day instead of 1, the example I took was the sertraline or Zoloft, and then you have to ring the PBS to get the 1 month supply as a 60 tablets, 60 with 5 repeats, then you have to get the PBS authority. And then the last thing I discussed was Regulation 24. Sometimes you have to prescribe medications with few repeats at the same time. The example would be like your patient's traveling somewhere. This happens in the GP setting, not in the hospital setting. Then you will have to prescribe medications with whatever the number of repeats your patient requesting, and then tick the Regulation 24 in your prescription. Remember, you have to, when you write a prescription, you have to write the, ideally the generic name, and then strength of the tablet in milligrams or micrograms or whatever units, grams, and then number of tablets and number of repeats. It's a good practice when you write prescriptions to say insulin, for example, write in words, units. And there's another condition which I should mention, like the drugs of addiction or the drugs which are dangerous for the patients in extra quantities, say like S8 medications, they call Schedule 8 medication under the PBS, like endone, targin, morphine, those sorts of medication. when you prescribe, you are supposed to hand write the details of the prescription in the space under your printed prescription. This is mainly in the GP clinics. Okay, I think I have given you enough information about prescriptions. I'm pretty sure that you will now familiar with PBS. I'll put the link of PBS under this video. Thank you.